And in part, you heard mentioned preliminary budget numbers that are just out on what is supposed to be the final health care bill. But there is still no official cost estimate on this thing. We've all been waiting on the CBO estimate, the Congressional Budget Office estimate. Well, now we have leaks and suggestions about what that estimate is, but we still do not have the actual estimate. Democrats are telling us that the early numbers prove their plan pays for itself and cuts the deficit. Republicans firing in emails faster than we can keep track of, saying, not so fast. You've got to take a closer look at the math behind these numbers. Jim Engel's been following this very closely. He joins me now. Jim, it's so deep in the weeds, but it's a critical point. The CBO is going to score this bill, and it's going to attach a price tag to it. And not only does that have an impact on our national economy and our deficit and so on, but it has an impact on whether this bill can be handled the way the Democrats plan on handling it, i.e. by reconciliation over in the Senate. In other words, if it doesn't meet certain thresholds, that 51 vote thing may not be possible. You've been looking at, in particular, the representations that are being made when it comes to the biggest thing in the bill, which is Medicare. What is the headline on that, so far as you can tell from what we learned about the CBO report so far?
Well, there is no change that we can tell, Megan, in the new CBO score from what CBO had previously said about the health care reform bills. Look, the Medicare is one of the huge snags in the financing for health care reform. Here's the deal. Fully half of the funding for the Democratic health care reforms come from cutting almost $500 billion in Medicare expenditures. Now, keep in mind, Medicare has $38 trillion in unfunded liabilities, promises that have been made that it cannot pay for, and it starts running short of money in 2017. Now, the president argued earlier this week that cutting Medicare spending will actually help the program. Listen to this.
This proposal makes Medicare stronger, it makes the coverage better, and it makes the finances more secure. And anybody who says otherwise is either misinformed or they're trying to misinform you.
Now, actually, many, Megan, say that the president himself is misinformed because the $500 billion in cuts from Medicare are counted as helping its survival, but the same pot of money is siphoned off and spent on other programs. Megan?
What does that mean? I don't understand how they can do that. How they can say, "Don't worry, we're going to save $500 billion or million," and yet they're spending it someplace else. How does the non-partisan, independent CBO allow that sort of counting of the money twice?
Well, they can't understand it any better than you can. Look, they don't allow anything. They just take the numbers and say, if you do this, it'll add up to this. If you do this, it'll add up to this. The problem here is that they first count the money as savings in Medicare, but then they spend it to pay for all those subsidies they're going to give people to buy health insurance and other reforms. The CBO, neutral referee, as you said, says you cannot do that. A CBO letter on this weeks ago said to pay future Medicare benefits and financing new spending outside of Medicare would essentially double count a large share of those savings and thus overstate the improvement in the government's fiscal position, meaning it's budget matters. In other words, you can't have it both ways. Either there is more deficit spending than it appears, or Medicare is left exposed just as the baby boomers start retiring.
All right, so the CBO is on to the double counting of the $500 billion in Medicare savings. Is that factoring in at all to the numbers that we expect from the CBO? I mean, do we expect the CBO then to come out today and say, you know, the jig is up, the numbers don't add up, it's actually not a cost-saving measure here?
No, what they say is you can't double count them. If you're going to save that money in Medicare, it will extend its life. If you're going to take that money out of Medicare and spend it somewhere else, it won't extend Medicare's life. But they won't tell you, give you different numbers for what will happen if you do one or the other. Now, Brett Baer, in his interview with the president yesterday, raised this whole matter of double counting, Megan. The president wouldn't acknowledge what experts in his own administration say about it. Here's what he said.
The key is that this proposal doesn't weaken Medicare. It makes it stronger for seniors currently who are receiving it. It doesn't solve that big structural problem, Brett. Nobody's claiming that this piece of legislation is going to solve every problem that's been there for decades. What it does do is make sure that the trust fund is not going to be going bankrupt in 7 years, according to their accounting rules.
Now, there you go, Megan. That's both the CBO and the chief actuary of Medicare, who is an administration official, say if the bills, the health care reform bills, spend that money elsewhere instead of leaving it in Medicare, it will not protect Medicare, as the president seemed to claim just yesterday in his interview with Fox. Megan?
Wow. You know, it's so already we're getting reaction pouring into this. You know, critics crying foul on what they believe the Democrats are saying about the CBO and the report and the expected numbers. And some top Republicans are saying if this goes through, we will go line by line through every piece of legislation, through every appropriation to any district across the United States, and we will make sure that no special deals were cut on this. If anybody suddenly, you know, has $100 million for a medical center we didn't know about, we're going to be calling you out on it. We're going to talk about that in our next segment. But Jim Engel tries to shed some light on some very